While it is widely known that sleep is an essential part of our lives, it is sometimes a process that is taken for granted. When we go to bed, we don't expect that something will go wrong in our sleep, much less for the issue to continue. For sleep to be effective, it is necessary for a person to go to sleep for the right amount of time and go through all 3 stages of sleep, including rapid eye movement as the most important one. These processes go in cycles that require from 90 to 110 minutes, but they can sometimes be interrupted. How well a person sleeps can affect mood, productivity, stress, and health. Sleep guards your mental and physical health. While a lack of sleep by itself is not deadly, it can cause the body to not act as it should. Changes in blood pressure, heart rate, and body temperature can bring complications that can lead you to death. Such is the importance of sleep that sleep clinics have been built all around the world to study these abnormalities called sleeping disorders. Sleep clinics diagnose disorders by measuring how long it takes you to fall asleep through a spinal fluid analysis and through a nocturnal polysomnogram. This measures electrical activity in the brain, heart, and movement of the eyes. The sleep disorder that we are most familiar with is insomnia. This is the inability to sleep. It is the most common around the world. It can be caused by stress, jet lag, medications, coffee, or other health issues, but it can be caused by other sleep disorders or cause other sleep disorders by itself. Sleep paralysis. This is the second most frequent around the world. 50% of people will experience this once, but only 4% will have more than 5 episodes. This occurs during the rapid eye movement stage when a person is dreaming. Your body is paralyzed, so you don't act out your dreams. Sometimes people wake up during this moment. Aside from the terror where you can't move your body, it sometimes comes with visual and auditory hallucinations which cause panic and shortness of breath. This can be blamed for the visions present in so many cultures around the world, such as incubus. The good news is that it is relatively harmless and no cure is necessary. Narcolepsy, infrequent but fairly known. It is the excessive or uncontrollable daytime sleepiness and muscle control loss while doing day-to-day activities. It is thought to be triggered by strong emotions, but can also be due to genetics, a virus, lack of hypocretin. There is no official treatment for this whole condition. However, there are partial treatments that can help you control the symptoms. Klein-Levin syndrome or sleeping beauty syndrome. It is when a person sleeps up to 23 hours per day for 3 weeks in a row, and it is difficult to wake up the sufferer. Mostly affects 15-year-old males. It can be linked to binge eating, compulsive and childish behaviors, hallucinations, and confusion. The good news is it is sometimes caused by an infection, so lithium medication is sometimes helpful. Fatal familial insomnia. This is the gradual increase of having trouble sleeping until the sufferer can't sleep at all. It can lead to difficulty walking, muscle twitches, hallucinations, dementia, and on the worst case, death. The good news is that it is extremely rare and it is genetic, so the person would know if it was a possibility to suffer from this. Exploding head syndrome. This is when a person is about to fall asleep or just after having fallen asleep because of too much neural activity after a disruption such as jet lag. These are accompanied by auditory and sometimes visual hallucinations too. Loud noises wake up the sufferers such as explosions, gunfiring, doors slamming, trains passing by, cymbals being smashed together. Afterwards, some people experience a bright flash of light. The good news is that it is fairly harmless since the experience only leaves anxiety. So now that you know this, take care of yourself and sleep the hours you're supposed to. Your health and your mood will thank you for it.